I will not be running all the slides if they start displaying it. Basically, it's not the amount of grafts that we harvest. It's the number of hair that grows. So I'm going to claim a statement over here. What I save, so shall you reap. Keep on. Chalte rahiye. Next. Okay, there are many factors through which we can save the number of hair. There is the patient factor. Do not operate on very young because you will be like inclined to draw the juvenile hairline, and whatever you draw, whatever hair that you use in the juvenile hairline, you have lost almost all of them. The practitioner factor, the important thing about this is that locum versus permanent. Train your own staff. The locum staff is not going to be interested in your result. They will not be interested. They will not be there when you call the patient back. So try to train your own staff. Try to hire them and train them. The experienced ladder, too experienced to change. If you have too experienced staff, they're going to resist any change that you want to put in. I had to let go most of my staff because I was introducing the implanters, and they did not want to go low on their speeds. Linear scar surgery, well, this is a debate that Dr. Hamayu has introduced. I'm going to skip this altogether. I'm just going to talk about FUE losses. Every graft has to have an exit angle, which is when it is coming out of the skin. So inside the skin, there is a different direction. Outside the skin, there is a different direction. Plus, there is a tethering to the connective tissue, very important, because you may have to dig deep inside to draw that graft out, or it may be very much superficial. So this is a drawing that I made. I'm sorry for that. So this punch has to go in deeper if the tissue is tethered very well to the follicle unit. So if you're going in deeper, you're going to be cutting one of the hair from any of the sides. So you will have lesser number of hair follicles per follicular unit. So the hair is curved differently in different individuals. So you're going to lose all of them. This is another kind of a simple classification that I've created. Now we are the second grade. So the hair is going quite deep inside. So usually we have to dig quite deep inside to draw out a graft. While the first category is, iska pointer kidhar hai? Button. Pointer ka button de do. Chalate kaise bhaiya? Okay. So this is what a Caucasian would be. Very shallow root, very easy to do an FUE in. This is us, a little difficult. This is an Asian, very difficult to do an FUE unless and until we are using a blunt graft and the tethering to the surrounding tissue is not much. And this is a black, almost next to impossible to do an FUE in. So this is the splay factor that I'm trying to display, very difficult for doing an FUE in this situation, a difficult case. So this is a discussion that I really want to take care of this. In FUT, we are usually cutting out this area, and in an FUE, we are taking out this area. Now, the point is that hair in this region are not very permanent. So if you're going to take all this area out to increase your number of grafts, the hair that you take out from this area are eventually going to, stay for an eternity. 15% of hair loss is there from this area throughout the life, and this area has a greater loss. So when you take them out, you mix them up, and you will lose a lot of hair. So another point that I want to show you, this is an FUE extraction. Where are you holding the graft from? You are either holding it from the bulge area or the bulb area. You're going to destroy the graft. And the last slide is going to be the damages in FUT and trichophatic closure. When you're trying to do the trichophatic closure, if you are dipping in too deep, you are destroying the sebaceous gland. So there will be reduced growth over there. The stitch necrosis and complications have all been discussed. The last slide I would like to show you. This is how you can damage okay, I cannot manage that. Keep your graft wet. That is the most important thing that has to be done. Reduce the out-of-body time. That is another important thing that has to be done. So if you are keeping the graft wet adequately, it is going to survive more. I guess that should be enough. Thank you.
Thank you very much. Thank you very much.